Now, this week, the government announced pay rises for millions of public sector workers, including NHS workers, teachers and police officers. The vast majority of those pay increases fell below the level of inflation. Unions are pressing for pay to reflect living costs, saying the current offer is a kick in the teeth for Britain's key workers. They say the potential for widespread strikes this autumn is now a real possibility. But with the disruption that would cause, we're asking, are public sector strikes justifiable? Here to discuss those issues in the studio are Patricia Marquis from the Royal College of Nursing, journalist Sarah Linney, and Jason Reed from Young Voices UK. And joining us remotely from Italy is Imam and political commentator Ajmal Masroor. Good to see you all. Patricia, I'll start with you. The government announced a raft of pay increases, as I said, for public sector workers. They may not be in line with inflation, but so many people in other industries aren't getting any pay rises. Why are public sector workers special in your eyes?
So from my perspective as a nurse and speaking for nursing, the rise is way below inflation, but also comes on the back of years and years of below inflation rises. So nursing pay has fallen further and further behind, and it's now just really questionable as to whether it's an attractive career, because the salary is just not commensurate with what nurses do. So it really is for us not just about the pay rise. The situation really now is really difficult, and there just aren't enough nurses to deliver what the public need.
Yeah, and Sarah, that's a fair point, isn't it? And we know that last month there was a 184% increase in Google searches for Join Union. So it's not just nurses, it's right across the board. You're a socialist, I think you'd say that, wouldn't you?
Yes, definitely.
So this is a good thing, isn't it?
Yes, it is. And generally, this is why I'm so surprised to find myself in two minds about a lot of these strikes, because generally I would always support strikes, would always support anything that gives workers more power. But I feel that it is the wrong time at the moment. Nobody has any money. The government doesn't have any money. Nurses are, in many cases, not on high wages, but even a nurse's starting salary is more money than I have ever earned in any job that I have ever done. And there are many people in the same or worse boats. And I think that rather than focusing on the groups who are unionised and well organised, the government should be targeting its help out the most vulnerable and helping those who really, are on the breadline and, are worried about how they're going to pay their bills this autumn. I think...
that's a good point. I want to put that to Ajmal. So, as Sarah says, there are people who are struggling. There is a cost of living crisis. And if people like nurses and teachers go on strike, they're going to be putting more stress on those people who are struggling the most.
Well, look, the very nurses and doctors who we clap for because they were saving our lives during the COVID crisis, the doctors and nurses who are saving our lives on a daily basis in our hospitals, who would I prefer get a better pay rise? The bankers, the energy companies' CEOs, or the nurses and doctors? I prefer the nurses and doctors get better pay rise because they are crucially those people who are doing the best in our communities to keep our lives and our communities safe. The teachers are keeping our children and giving them education. They're going to be the biggest brains in our world to make a benefit in the world. Prime ministers of the future. So therefore, I believe the public sector workers deserve better pay rise. I know nurses who can't pay their rent in London. They work, and at the end of the month, they have nothing left. I know nurses who have taken 2-3 jobs to survive. Okay. I wouldn't trust a nurse to have taken 2-3 jobs and to be able to provide effective medical care. I'd rather see public sector workers get a better pay rise and provide a good service than having to run behind money.
Yeah, OK, we understand that, but what about talking about striking? Why should they be striking?
Well, why do people have to go to strike? Because the people who are striking, they're saying the government is not listening. The government isn't actually entertaining a viable option. They are hell-bent on having it their way or their highway. That's the very reason why we are seeing that there is a strike. Okay. And this strike is the only way the government will listen. unfortunately. I don't want a strike, of course. It's inconvenient for many of us. We'd rather have them have a conversation.
Yeah, so we get that point. It sounds like someone's having a conversation in the background there, if you can get them to be quiet later on. And maybe someone was hoovering earlier as well. So if we get that sorted, we'll come straight back to you. Look, Jason, I'm looking at the front page of the Sunday Times. It's no longer feasible to be a full-time GP. The article goes on and talks about how a third of all GPs are considering giving up in the next 5 years. The point that Ajmal makes, they need to strike because nobody's listening to them. That's a good point, isn't it?
Well, I think talking about any kind of recruitment crisis, whether it's for GPs or nurses or anything else, is besides the point. The NHS is already the 5th biggest employer in the world. It's taking an ever-growing share of public spending, more and more taxes going into it. Other countries across Europe do a much better job with a slightly different system for much less money. When you look at actual outputs, survival from cancer and ambulance waiting times and the backlog and things like that, the NHS is not performing as it should be, and throwing more money at the problem isn't a solution. Ajmal was talking about gratitude for what people did during the pandemic. Of course, we're grateful for people on the front line during the pandemic, but that's a really bad way to decide someone's salary. We have a really good...
They don't feel listened to, so they feel they have to strike.
But we have a really good system for deciding salaries at the moment, where we have pay review bodies that look at all the evidence. We can debate percentages, but we're not economists. We haven't got the information we would need. The problem with unionism and striking is there's no conclusion. You can just keep on striking theoretically forever, and that money has to come from somewhere, and it's coming from taxes on working people. We already have the highest tax burden since the Second World War. It's only going to get worse during the cost of living crisis. The last thing we should be doing is taking money away from working people to give to disproportionate pay rises in the public sector.
OK, lots of people getting in touch. I'll put this to you, Patricia. Mark has contacted us on Facebook. He says it is totally unrealistic to expect to get a pay rise of 10% or more, which is the point that Jason was saying. If everyone did that, then inflation would simply skyrocket. Trade unions need to face reality and stop acting like the local school bully. Like, when you hear things like that, do you worry that if you were to go on strike, the nurses, you would lose public support? Because that's key, isn't it, when you go on strike? You need people behind you.
It absolutely is. And just picking up one point, this is years of underinvestment in the NHS, and whatever happens, whatever sort of funding system we have for health, nurses need to be paid more. It's got to be an attractive profession to enable people to join and to stay in it. So in terms of the public support, we know from the surveys we've recently done, 60% of the public do support us. And for the majority of nurses, this has not come as a quick thing. The Royal College of Nursing has never taken strike action in England before. We've been around for over 100 years. This has come at the end of many, many years of trying to make the point that we need more nursing staff. And so I think the public will be with us, and nurses will be doing it partly for themselves, but for the majority, it's for the patients.
And what about those patients who are worried that they're not going to get the treatment that they need?
We demonstrated in Northern Ireland we can do it safely. We would take a life-preserving, a limb-preserving model where services would be provided that need to be provided to keep people safe. But this is nurses at the end of their tether, desperately trying to enable the services to continue. They're not safe at the moment.
Yeah, OK. I mean, so it strikes me, listening to the arguments, there are two sides to this argument, but you all want the best for the end user. So in terms of hospitals, nurses and doctors, it's patients. For you, you think if they strike, they're disrupting the patient service, and we want value for money as the public, so we don't pay the nurses, 9% or whatever. But for them, they actually want the best for the patients, but they feel it's the problem is that the government are underfunding the NHS and not paying nurses enough, and nurses are leaving the profession, and so on and so forth. And to be honest, she's on the front line. I sort of trust her more than I trust you. How would you, how would you respond to that?
That's completely fair enough, and it's easy to slip into the trap, I think, of just saying, we don't want to pay people more. Of course we want everyone to be paid more, but then it just becomes a sort of competitive gratitude. I want all nurses to be millionaires, and if you don't support me on that, then that must mean you don't care as much as I do about what they did during the pandemic. But that's silly, of course. There's a trade-off. The money has to come from somewhere. NHS spending goes up by billions every year. So if this is underfunding, I hate to think what overfunding would look like. I'll say again, it's already the 5th biggest employer in the world. So I find that a staggering statistic. We're not getting value for money as taxpayers, and that means it's worsening the cost of living crisis for everyone else.
Ajmal, some of these jobs, you think about nurses, teachers, doctors, they're sort of vocational. People do them because they want to care for people. That's part of the reason. But now it's sort of about money. I'm thinking religious leaders are in that as well. Are we getting to this stage where people just want money and maybe religious leaders are going to go out on strike soon?
That would be funny if I, as an imam, I was on strike. I don't think I'll be even allowed to do that. But look, this is a very simple thing. Even God wants us to pay our workers fair wages. We need our workers to be able to afford to pay for their families. They need to keep their roof over their head. They need to be able to provide good education. It should not only be for the bankers and the millionaires to be able to afford good education for their children. So God wants us to be fair to people as a Muslim. We have to pay our wage to our workers before their sweat dries, said the Prophet. We need to be fair and just to our workers, treat them well, and create an environment where people don't need to do strike to be able to get their voices heard. If the employers were listening, if the government was listening, and if we were not dismissing the vital services the key workers are providing, we won't be having this conversation. We all need to keep our communities together. And the way to do it is to be fair and to listen to people's needs. What makes me very upset is that a very small band of people are getting richer by the day, and the rest of us, the paupers, are getting poorer by the day. The system is wholly wrong, and here is the religious element or the godly element, and that is bring back compassion in everything that we discuss and negotiate.
Yeah. And Patricia's nodding away. Sarah, you're not so much in agreement. And Patricia mentioned a figure there. 60% of the public would be in favour of nurses striking. Do you feel that you're swimming against the tide? And you're a socialist as well. You really are swimming against the tide when it comes to socialists here.
I actually don't. I would say that I surround myself with quite a varied circle of people, and it is actually my impression that most people don't support these strikes, not completely anyway. I think public sector workers are not uniquely hard done by. The unions have agitated for well into 2021, calling for restrictions, calling on the government not to come out of lockdown. Both the nurses' unions and the teachers' unions were in favour of continued restrictions. It is obvious that if you shut the economy down for 2 years, you are then going to have a cost of living crisis. So it then seems to me not particularly reasonable to complain that you are then suffering the consequences of that cost of living crisis. I would also argue that patients and children and a lot of very vulnerable people have suffered as a consequence of those restrictions, and that if we now cause more disruption to children's education, yet more postponed hospital appointments, that is impacting some of the most vulnerable in society. So I have a long-term heart condition. My next appointment, and I have recently had an abnormality diagnosed, my next appointment with my cardiologist is in February next year to even find out what this means, and he will not see me face-to-face. He is still refusing to see any patients face-to-face. I will only have a phone conversation to take in this quite complicated information. If we're going to have a pay rise, I think that perhaps we should expect an improvement in services.
Well, we're running out of time. I just want to get Patricia's response to that.
And you know, nurses will not take this lightly. It's at the end of their tether. Things are not safe, and you're demonstrating exactly why we do need to do this, because the NHS health services are just not safe at the moment, and they are not delivering what they need to do. And the reason for that is not just the economy, it's staffing. Years and years of underfunding that has led to less and less people staying in the profession from a nurse's perspective and being there to deliver the care. It really is a dire situation, and that's what nurses will be fighting for.
Yeah.
Absolutely, to enable patients to have what they need, when they need it and where they need it.
It's a difficult situation, and this is a debate that will run and run. Thank you all so much for coming in and sharing your views on what is an emotive subject.